Imagine you are walking through a prehistoric forest. The year is 12,000 BC. You're tracking a deer, your eyes focused on the tree line, when your foot slips. You slide down a rocky slope, and a jagged edge of raw obsidian slices a deep, 3-inch gash across your thigh. The pain is instant. It's a blinding, hot iron spike driving into your leg. But as you look down at the blood welling up through your fingers, the physical pain isn't even the worst part. The real terror is what happens next. You live in a world with no hospitals, no pharmacies, no sterile bandages, no rubbing alcohol, and absolutely no Advil. You can't dial 911. In the prehistoric wild, a deep wound isn't just a painful inconvenience, it is a countdown. Within days, microscopic bacteria you can't even see will enter that cut. Your leg will swell, turn a sickening shade of purple, and smell of decay. If you don't do something, you will die a slow, agonizing death from infection. But our ancestors didn't just lay down and die. Over thousands of years of trial, error, and sheer desperation, they developed methods to survive pain and trauma that are as ingenious as they are absolutely bone-chilling. Welcome to the disturbing, bizarre, and terrifying world of how early humans treated pain. Let's go back to your open wound. It's bleeding heavily, and you need to seal it shut to stop the blood loss and keep the dirt out. You don't have needle and thread. So, what do? You reach down into the leaf litter and search for a very specific ally, a soldier ant. In regions like South America, Africa, and ancient India, early humans discovered that nature had already engineered the perfect surgical tool. Soldier ants, specifically army ants or leafcutter ants, possess massive, hook-like mandibles designed to bite and hold on with relentless, crushing force. You squeeze the edges of your jagged cut together, holding your breath. With your other hand, you pick up a writhing, angry soldier ant and bring its head directly to your open flesh. The ant, feeling threatened, reacts the only way it knows how. It opens its jaws wide and clamps them shut, piercing through both sides of your torn skin. The pain is a sharp, burning sting, but the jaws are locked. They act exactly like a modern surgical staple. But you can't just walk around with giant, angry ants hanging off your leg. So, while the ant is still biting down with all its might, you grip its abdomen, give it a sharp twist, and snap its body clean off. What you are left with is just the ant's head, its dead jaws permanently locked in place by rigor mortis. You repeat this process 5 times, 10 times, until you have a neat row of organic, biodegradable staples sealing your flesh. This wasn't just a desperate jungle myth. This technique is so effective that it was documented in the Atharva Veda, an ancient Indian text from 1000 BC, where surgeons actually used these living staples to seal intestinal wounds during abdominal surgeries. It worked because the ant's jaws provided a tight, strong hold, and some species even produced formic acid, which acted as a natural, mild antiseptic. But as painful as having your skin stapled by angry insects sounds, it was nothing compared to what ancient humans did when the pain was inside their own heads. Imagine you are suffering from a blinding, soul-crushing migraine. Every beat of your heart feels like a hammer striking the inside of your forehead. Or perhaps you took a heavy blow from a stone club during a hunt, and your brain is swelling against your skull. In the Stone Age, you don't understand neurology. You believe that a dark, malevolent spirit has crawled inside your head and is trying to claw its way out. To save you, the tribe's medicine man steps forward. He doesn't offer you a comforting tea. Instead, he produces a piece of razor-sharp obsidian or a coarse, circular stone drill. Several strong hands pin you to the dirt floor of the cave. And then, the scraping begins. This is trepanation, the oldest surgical procedure in human history, dating back over 10,000 years. Without a single drop of anesthesia, the medicine man grinds the sharp stone directly into your scalp, cutting through the flesh until he hits the hard, white bone of your skull. He doesn't stop. He keeps scraping, slowly carving away a circular channel of bone. You have to endure the agonizing pressure, the smell of burning bone dust, and a sound that vibrates directly through your ears and into your soul, the wet, gritty rasp of stone on living skull. Eventually, with a dull pop, the stone punches through the final layer. A circle of bone is popped out like a cork, exposing the pulsing, gray membrane of your brain. Incredibly, this wasn't a death sentence. When archaeologists first discovered these skulls in the 19th century, they were shocked to find that a massive percentage of them showed signs of advanced healing. The edges of the holes were smooth and rounded, meaning the bone had grown back over months and years. These ancient surgeons actually had survival rates of over 70 to 80% in some regions. And while they thought they were letting out evil spirits, they were accidentally performing highly advanced neurosurgery, relieving pressure on the brain caused by head trauma, subdural hematomas, and severe epilepsy. But what if you didn't want a hole drilled in your head? What did you take to numb the pain? Long before modern labs synthesized pain-killing molecules, humans engaged in a high-stakes game of botanical roulette. They ate, smoked, and brewed everything they could find to see what would dull their agony. And they found some incredibly potent, and incredibly dangerous, answers. Take henbane. In the ancient Mediterranean and Middle East, if you had an excruciating toothache, the local healer wouldn't pull the tooth immediately. Instead, they would heat up a pile of charcoal and sprinkle henbane seeds directly onto the glowing embers. You would be instructed to lean over the smoke, open your mouth, and inhale the thick, heavy fumes. Henbane is packed with atropine and scopolamine, powerful, toxic alkaloids. As the hot smoke filled your mouth, it didn't just numb your gums, it triggered vivid, terrifying hallucinations. In small, inhaled doses, it temporarily paralyzed the nerves in your teeth. In larger doses, it would cause your heart to race, your pupils to dilate, and eventually, put you into a permanent coma. Then, there was the Sumerian joy plant. As early as 4000 BC, the Sumerians in Mesopotamia noticed that the milky sap of a certain red flower could completely erase pain, anxiety, and fear. They had discovered the opium poppy. Roman and Greek doctors would later use it as a standard anesthetic, recognizing its miraculous power to block pain, even as they watched patients succumb to its highly addictive, and often fatal, grip. But the most common painkiller was far more modest. For thousands of years, if you had a burning fever or a throbbing muscle, you would strip the bark off a white willow tree and chew on the bitter, stringy inner layers. It tasted awful, but it worked. White willow bark contains salicin, a natural chemical that your body converts into salicylic acid. Today, we know this exact chemical by a much more common name, aspirin. Our ancestors had mapped out a natural pharmacy. But when herbs failed, and a limb became blackened with rot, they had to resort to the ultimate, most painful cure of all. Imagine a wound that refuses to stop bleeding. Or a hand crushed by a falling boulder that has turned black with gangrene. To save your life, the limb has to come off. Using sharp flint or bronze blades, the ancient practitioners slice through the flesh. But once the limb is severed, you face a new killer, hemorrhage. You are bleeding out, fast. Without clamps, stitches, or modern blood transfusions, there is only one way to save you. The surgeon pulls a flat stone or a heavy iron rod directly out of the white-hot coals of the fire. Without warning, they press the glowing, red-hot metal directly onto your raw, open stump. The pain is a physical shockwave that completely short-circuits your nervous system. Your flesh boils, turning to charred black carbon in a matter of seconds. The smell of your own burning body fills the air. Most patients passed out instantly from the sheer shock of the agony. But when you woke up, you were alive. The heat of the metal had instantly cooked the proteins in your blood vessels, melting them together and sealing the wound shut. Cauterization stopped the bleeding in seconds, and more importantly, it sterilized the tissue, killing any bacteria that survived the surgery. It was a brutal, agonizing torture, but in a world without antibiotics, fire was the only thing standing between you and a grave. Today, when we have a headache, we walk to the kitchen, swallow a tiny pill with a glass of water, and wait 30 minutes for our pain to melt away. We don't even think about it. But the path to that pill was paved with thousands of years of unimaginable grit. Our ancestors endured skull drills, glowing hot irons, and toxic fumes, all because the drive to survive was stronger than the agony they faced. They were tough. They were resourceful. And they did whatever it took to make sure their story, and your story, didn't end in the dark. So, the next time you complain about a paper cut, remember what it used to take to get a stitch.